everyone, and welcome to the Nutrition and Health for Life YouTube channel. My name is Michelle Teixeira, and I am a registered nurse for Community Action Corporation of South Texas Head Start Birth to 5 program. So today we have a very special guest, Dr. Franz Puyol. He is a pediatrician here in Dallas, Texas. Thank you very much, Dr. Puyol, for dedicating your time to talk to our parents.
Hi, Michelle. Thank you for inviting me, and thanks Community Action of South Texas for having me here.
Okay, all right. So today we will be talking about iron deficiency anemia. So Dr. Puyol, can you explain to our Head Start parents what is iron deficiency anemia?
Well, it all starts with what is anemia. Anemia is basically when your body has less red blood cells, and the most common cause of anemia is when you have low iron in your body, because iron is necessary to make red blood cells. And so.
Awesome. Okay. So what are the signs and symptoms of iron deficiency anemia?
Iron deficiency anemia normally develops slowly, and so the symptoms and signs might be very difficult to identify. Probably the most common one is the child might look pale. Sometimes the child may have a poor appetite or may look tired or lethargic. One interesting sign of anemia is something called pica, when child starts to eat things that are not food, like dirt, which is not a common sign, but if we hear that, we normally suspect that the child may have anemia. If the anemia progresses and becomes very significant, a child may have the symptoms may be worse, like the development of the child's motor skills may be delayed, or the child may be lethargic, or if the child develops an infection, they may have difficulty fighting infections, because iron is important for fighting infections too.
Wow, very important information. Another question, what causes iron deficiency anemia?
Well, it's important to divide this into, from birth to 1 year, children either get breast milk or formula. So the breast milk has enough iron for a baby normally until about 6 months. And after 6 months, it may not be enough iron, but by then children are given solid foods that normally contain iron. So normally there is a balance there enough to prevent the anemia. Kids who are on formula, all formulas have the same amount of iron, so it's very rare for children on formula to develop anemia, except for we sometimes see parents who are introducing whole milk to babies early in life, like at 9 months, because they feel that the baby is ready, when actually it's important to recognize that that is not a good practice, because if the child starts drinking milk, milk does not have iron. So after a year of age, when children are transitioned to whole milk, the most common reason for iron deficiency anemia is excessive milk intake. Milk has no iron whatsoever, so a child who drinks a lot of milk, especially a child who is drinking a bottle, and he drinks several bottles a day, because they're drinking a lot of calories through milk, they may sacrifice eating foods that contain iron. So it's very common for us to see a child who is 18 months of age who's drinking 5, 6, 8 ounce bottles a day of milk, and when we ask parents, the child is eating very little because he's getting all his calories through milk.
Wow.
So is the most common cause of anemia at that age. The other is a child sometimes who has a very poor diet, like is eating junk food, or it drinks a lot of juice, or eats a lot of sugar, and things that are not supplemented with iron. So, but by far the most common cause is excessive milk intake. On the breastfed baby, some babies who are breastfed after a year of age, if the child also breastfeeds a lot, and we see that on occasion, a child who breastfeeds too much and is not eating, that can also develop anemia, because after a year of age, breast milk does not have enough iron content. So if a baby on breast milk is not eating, that can also cause the child to be anemic.
Well, very good information, parents, very good. And Dr. Puyol, how is the iron deficiency diagnosed?
Um, by blood test. It's very difficult to identify anemia by physical exam unless the child is already very anemic and they looks very pale. That's why it's recommended that a child, when he turns a year and they go for the 1-year-old checkup, to screen a child for anemia. And we measure something called hemoglobin. We don't actually measure iron. Hemoglobin is a protein that carries the oxygen in your blood to all the organs and tissues. And if you don't have enough iron, your hemoglobin will be low. And that's what we normally check on a baby.
Wow, wow. And how is iron deficiency anemia treated?
Yeah, the most important thing is prevention, right? It's important that if a child has a good diet, does not drink a lot of milk after a year of age, is not introduced to milk before the year of age, the child should be on either breast milk or formula. And he has a diet rich in iron, which iron is in foods that normally have color. So, for example, egg yolks have iron, red meats, green vegetables. It's important also to know that the iron in meats and eggs, for example, is better absorbed in your body than the iron that is on vegetables. So, for example, people who are vegetarian, they need to eat more vegetables rich in iron to prevent them from being anemic. But anyway, so prevention, a good diet that contains iron, and if the child is found to be anemic, if it's a significant anemia, unless it's very, very mild, most of the times we'll give the baby an iron supplement, which is normally a liquid. We tell parents that when we give iron to a child, they should give it with vitamin C if possible, because vitamin C increases the absorption of iron in your body. So fruits that contain vitamin C, like oranges or tomatoes or strawberries, or simple as give the child a small amount of orange juice with their iron, helps the child absorb the iron better. That's the same reason why kids who have a good diet on fruits and vegetables, they will rarely develop anemia. It's usually the child who just drinks a lot of milk or eats a lot of junk food.
So the nutrition is the key. Yes, very good. Great. I would like to say thank you, Dr. Puyol, for taking the time to explain to our Head Start parents about this important topic. So our mission at Head Start is getting young children and their families ready for school and ready for life. Thank you so much.